Hi, and welcome to today's installment of In Medicare News. Today is August 16th, 2018. The article is from an Insurance Agents Only magazine, so I'm not going to link to it because it's not really designed for the general public. The magazine is called insurancenewsnet.com. If you want to find it, you can go to insurancenewsnet.com and look for August 16th, 2018, and you will find it. The article is titled, Survey Finds Big Fluctuations in Medigap Pricing. Now, I am a fan of, maybe I'll link to it anyway. I am a fan of this magazine. I do read it often, and I am a contributor to it as well on occasion, although I had nothing to do with this one. I was quite surprised to find it listed in their top stories of the day. Medigap, as some of you know, especially if you follow my videos, Medigap is the official term for Medicare supplements that the government uses. Medicare Supplement, Medigap, two words meaning the exact same thing. The same happens with Medicare Advantage. We call it Medicare Advantage. The government calls it a Medicare health plan. It's the same thing. But this article is the results of a survey put out by the American Association for Medicare Supplement Insurance, another group that I am involved with. And this article says that rates for Medicare supplements in 2018 vary significantly. Now, any of you that have worked with me know this because I show you the rates, and I typically, if we're sitting down, especially for the first time when you're turning 65, I will show you the rock bottom cheapest Medicare supplement rate available to you in the state that you live in, and then I will scroll down and show you the absolute most expensive rate that you can get in the state that you live in, and you are shocked when you see it, and your first question is almost always, why is this company so much more? What are they doing? Well, there's a whole bunch of reasons why some companies are significantly more than others, but the benefits are exactly the same. So here's some highlights from that article. In New York City, granted, I don't sell in the state of New York City. I'm not licensed there. I'm reading an article here. I work in the states of Ohio, West Virginia, and Kentucky. The rate in New York City for a 65-year-old female non-smoker, non-tobacco user, varies between the lowest and the highest by as much as 143%. However, people in Jacksonville, Florida, the rate between the smallest and most expensive is by 13%. Surprisingly, they mention Columbus, Ohio, which is a place I do serve. In this national article, they mention Columbus, Ohio. The percentage difference between the lowest and highest Medigap plan rates for women was 97%, and for men, it's 86%. Now, that says Columbus, Ohio. The rates generally work in the state of Ohio by zip code. Columbus encompasses more than one zip code, so that might be plus or minus a few dollars difference. Plus, that percentage is actually respective of the fact that we were talking about August 16th, 2018, the way rates work on a Medicare supplement. We talk about this beginning August 17th, and that number could be totally off. But on this date, they are reporting that it is 97% different. That means, put that in regular numbers, that means that the cheapest Medicare the cheapest Medicare supplement is literally almost half the cost of the most expensive. The difference between 97%, or the difference in 97% premium, is literally the difference of about $100 a month versus $197 a month. So, I mean, it is that significant. Let's see. They also go on to say the survey underscores why it is important for agents to shop around for Medigap coverage and for consumers to shop around for agents. That is true. That is important. That is the reason why I want to draw your attention to this, and that's probably why I'll go ahead and link this article so you can read it. And it's also the reason why you're most likely looking at this YouTube channel, and the reason why, really it's the reason why I do this stuff, is because I want you to shop. Hopefully you're going to look around and see that I'm knowledgeable enough that you're going to at least trust me enough to want to have a personal conversation with me, be it by email or over the phone or in person. My preference is in person at least once, but we don't have to. But that is important, and I kind of want to, and I'm also, by the way, going to redo this in a little bit on a Q&A video, so I mean, if it looks like you're seeing this twice, you kinda are, but I want to mention this as well, because this is a important Q&A, and it actually addresses a Q I got recently. This goes into a little bit of my personal history. When I first got into this business, I was an agent, not a broker. As an agent, I sell for one company, or I sold for one company. I'm not going to go over that company. We don't talk about company names here. But it is important to know that if you are just being presented a quote for a single insurance company, or if you are just talking with a broker or an agent that works for just one insurance company, and price is one of your most important factors in finding a Medicare supplement, continue your search. Now, if you really like the person, if you absolutely trust that person, then you're going to deal with that person and you're going to disregard what I'm saying anyway. But I have to tell you, a Medicare supplement is the same. The service that you get from each company is different. So that's why I say, if you really trust that person and he's only shopping one company for you, then, I mean, the service is what really matters, because the company is not going to be any different. But if service is important and price is important, and you are not completely in love with that insurance agent, or you're willing to say that this insurance agent is not going to give you basically the total satisfaction that you think you're going to get, shop it to someone like me. Someone that is going to take a look at the different prices of Medicare supplements. If you've been following my blog, if you've been following my YouTube channel, if you've been reading my website, you know that Medicare supplements are all the same from one company to another. The only difference is the price increases, which nobody knows for certain, and the customer service. And the customer service is going to be, for the most part, provided to you by your broker. If your customer service is not provided primarily by your broker, and when I say primarily, I mean at least the first step. You want your broker to be the first person you go to, or your agent to be the first person you go to. There may be some things that you're going to have to go to the insurance company for, and that's okay. I am not allowed to help with certain things. But for the most part, if you have a problem, or if you have an issue, or if you have a question, you want to be contacting your broker first, see if they can help you. Why? Because you already have a relationship. You're more comfortable talking to them than you are going to be about talking to someone that's, just there at the insurance company. So you want to do that. So that's the first thing. The second thing is, if that company, if they're not going to be doing anything different to you than the price, then you want to take a look at as many different companies as you can. Not to mention that price increase. The price increase is going to change over time, and nobody knows how the price is going to change. So we want you to be happy with that company. If you are happy with your broker or your agent, then you're going to be happy with the company, most likely for a fair amount of time. If you don't care, if you don't have a broker in mind that you don't want to use for all of your business, or an agent in mind that you want to use for all your business, then it's going to come down to trust and price, and the price is going to change over time. You want to take a look at that. Now, going back to this article, and again, that's why, just so you know, when I am sitting down with you, if you are selecting a Medicare supplement, or if this is a Medicare supplement presentation, if you select a Medicare supplement, or if you are looking for a Medicare supplement versus a Medicare Advantage plan, price obviously is going to come in, and you are talking to me, I am going to put the prices of as many companies as possible down in front of you. I will overwhelm you with prices. You will see at least 10, possibly more, probably more prices for the Medicare supplement that you are looking for. The prices will be accurate to that day, and it's going to have the name of the company on it. I will most likely have all, but I won't many, but I won't have all of those companies. The ones that I don't have prices for, that I have prices for, but I don't have a contract to sell, I will tell you that company. I will give you the information for that company, and you can contact them directly if you would like, even though I know that means that I will be, losing a potential client, losing a potential sale. If you are not happy with me just because I am giving you, say, the second best price of that day, I'm not going to keep you happy for very long. So I want you to be happy from start to finish, from soup to nuts. So keep that in mind. I will give you the price if you let me. All right, that's the next thing. So, and that's kind of one of the most important things. Now, going back to the article, one of the other things they say, the last thing they really say is some insurers, quote unquote, play games by lowering prices to capture new clients, but if consumers want to switch out of their Medigap policy 3 or 5 years down the road, they may no longer qualify due to health underwriting guidelines. So that is true, and I do caveat people with that. I'm not necessarily interested in getting people into the absolute lowest cost company that I can, because the lowest cost company is going to change from week to week. I'm sorry, it is. That's just the unfortunate rule of that game. I do want to get you in a company that I have faith in. I do want to get you into a company that I can work with, and I want you to be able to work with me. If your health does change, there is a potential you may be stuck. So I do want to caveat everything with that. But that's kind of the be-all, end-all of this article. Medicare supplement prices fluctuate greatly, and if you are dealing with just one person who is just going to show you one company, you need to look and deal with somebody else unless you have complete and absolute and total faith in that person. You want multiple companies. Now, that person may not be putting other companies in front of you. If they say, hey, I checked, this is my lowest price, this is the lowest price of the companies around, if they want to keep it simple for you, that's one thing. If you want to ask them, hey, can you give me some other prices anyway so that I can see and tell me why I don't like it, they should be able to do that. I can do that, and there are some people that I know, they tell me they want just kind of as simplistic an answer as they can get. That's very confusing sometimes, because if we're talking about prescription drug plans or Medicare Advantage plans and certain Medicare supplements, I do have to go over certain aspects of a presentation with people. That's kind of the law. And I do try my best to stay in that. But if it's it's somebody that I'm dealing with, it's a Medicare supplement, and they just need to know the price, and I know that they want to keep things as simple as possible, I'm going to give them as simple a answer as possible, subject to, the guidelines of this is how something works. And if that's the case, I'm going to give them a price. I'll tell them I looked at other prices, this is what I got. But if they ask me, hey, what are some other prices, or can we look a little bit lower, or can we look at, say, a different plan letter, and then I go over the differences of those plan letters, I will do that. And I will show you a computer screen, especially if we're sitting down, and say, this is the price. You can see it right here. And there has been more than a couple occasions each week, where someone's going to say, can we take a look at something else? And it's not the company that I looked at because they want a better price. I will give them the caveat, hey, this price is temporary. It's going to go up over time. The benefits are the same. The customer service is different, and over time, if you don't like this company, your ability to switch may be hampered based on your health at that time. But at the end of the day, you guys are in charge. That means if you're happier with company A than my recommendation with company B, and I have company A, I'm going to give you company A. So whatever you're comfortable with, that's what's most important, and that's kind of the takeaway that I want you to have from this article, is that the prices for Medicare supplements do fluctuate. You do need to look, and contact your people. If you've got a broker or an agency that you use, give them a call. If you don't, and you're in Ohio, West Virginia, Kentucky, or Michigan, give me a call. Be happy to help you.